Welcome to episode 6 of Dr Hatz vlog, Insights from a Clinician CEO. This episode is focused on artificial intelligence in women's health. And the reason we're focusing on this area is because for a long time now there has been significant disparity between the health and care that women receive in comparison to men, despite women making up 51% of the population. And that's due to many factors. That's due to a history of evidence and data which has been built mainly on male populations. And it's due to women not necessarily always having the best access and experience of healthcare. And I think that artificial intelligence could have a significant role in making some change and improving access and care for women. But for us to do that, we have to recognize some of the problems that already exist and then start to think about how we address them in the future. In particular, because with artificial intelligence, it works upon data, and a lot of that data will historically have some bias in it. So at Health Innovation Kent Surrey Sussex, we've been doing a lot of work in this space, looking at the role of the intersectionality between AI and women's healthcare. Early this year, we did a piece of work with the Department of Health and Social Care, championing and identifying pioneers in artificial intelligence in women's health. This was titled AI Visionaries 2025, celebrating those individuals that are doing work to look at gender disparities and artificial intelligence, but also leading the way when it comes to leadership in AI for women's healthcare. The booklet will be shared in the episode notes. And it was followed up by an event held by NHS England and the Department of Health and Social Care, focusing on responsible AI for women's health. I go to lots of conferences, but in this one in particular was really energizing because it was thinking about the problems of the past and acknowledging them. But there was so much energy in the room in terms of thinking about how we drive that change in the future. And all of those people in the room felt like they were going to be the significant change makers that help us address the problem of the past and really move towards a more equitable future when it comes to gender. So it's a really exciting place to be. And on the day I held a couple of conversations, one with one of the AI visionaries, Professor Susan Shelmerdine, and also with Jane Ollis, my chair.
There's a lot of ground to catch up on anyway around women's health before you think about, well, how do you deploy machine learning? How do you working with data sets that are correct, telling the truth? So I think this is a start of something that's just going to keep growing.
Yeah, for me, recognizing that is the most important thing. So a lot of people in the room today have been highlighting that we know this is a problem and we've got to do something about it, but also painting that vision for what it might look like in the future. I mean, even a piece of work that we've been doing around AI visionaries, they're focusing on who are those people that are driving that change. One of the other things that we heard was about founders of tech and AI companies. We heard that majority of founders are male, a very small percentage of founders are female, as well as being my boss. Yeah. You also run a tech company and a startup. Tell us a bit about that.
We're very proud to be a female founder because it's not an easy journey, whatever gender you are, but it's true that there's only 11% of female founders in deep tech, so it's a poorly served area and a great opportunity. I think for me, doing it as a slightly older entrepreneur is better because I'm just a little bit more, I won't say confidence, but willing to give it a go, a bit more of a risk taker. And the area that I've been really interested in around is stress in the brain and how the brain interprets stress. And interestingly, women suffer from that more than men. So women's brains are naturally wired to have a heightened anxiety response. And I guess that stems from being over time, a caregiver needing to be always on alert. So how do we actually support women to de-stress at the brain?
I love it. I mean, look, we can drive this change just by identifying those problems, acknowledging those problems, and looking at how we use technology to solve them. So really inspired by what we're hearing today and looking forward to see this all progress.
Stuff in the AI world is really taking off. I feel that it's now part of every single conference I go to. If it wasn't before, it now is, and it's really part of the conversation, I feel.
You've been driving that change for a while, though. Yeah. You've been doing a lot of work, particularly around pediatrics. Tell us a little bit about that.
Yeah, so my work in pediatrics is trying to develop pediatric-specific models for fracture detection, mostly because we need something that's a common disease that affects most children, and a lot of kids do fall and have fractures when they're growing up. And so I thought maybe having this tool that could really detect it better, especially with growing bones, looking a bit funny, looking different at different stages, would be a really great idea. And fortunately, we have gotten quite a lot of data. We've developed models, we've shown that they work, and we've got commercial tools now that can do that. But the thing that we're not doing or seeing so much of right now is real world change. So I think that's the next big thing we really need to try to find out about.
Is bridging that gap. I mean, you're one of the AI visionaries, someone championing this future. we talk about pediatrics.
Yeah.
Today we're focusing on what we describe as women's health.
Yeah.
What does that mean for girls? What does that mean for children? And then how can we change that future for them?
Absolutely. Well, I think for children, first of all, if they don't see AI being made for them, they're not going to trust it when they grow up. And maybe young girls who don't see a place for themselves in this digital tech future might not engage quite as much when they grow up. So we want to set a vision for when they grow up. But in terms of children, a lot of the caretakers for children are women who are looking after their children, taking them to the doctors. And so the AI that affects women's health and also affects children's health does inadvertently affect women as well. And so if they don't trust it for their own health, they might not trust it for their own children. And then children have this perception that AI is bad, whether they're young boys or young girls. They might have that perception, and then they grow up to maybe not wanting to engage. And the future is technology. It's data innovation. We've heard today you can't keep up with increasing your workforce. It just doesn't happen. So we need technology, and we need people to be involved and have their voices heard.
Yeah, I mean, what's really interesting, we also saw data from the Health Foundation that shows that women are less trusting or positive about the use of artificial intelligence in healthcare than men. If we don't change that perspective by showing them how we can help them, then that kind of that perception, that opinion will hold. It was great to hear some reflections on the day from Jane and Susan. Last year, we commissioned 2 pieces of work focusing in on this area. The first one was absolute diversity, looking at the root causes of gender bias and thinking about how you move forward and an actionable plan to address it when we work with artificial intelligence. The second piece of work centered around building women's health leadership, not just in AI, but in digital more widely. And we did this work with Professor Duggal, who shared some thoughts with us on this work and some of the actions and recommendations from it.
When we talk about health inequalities, I think that people think that's different to artificial intelligence, digital and technology sometimes. And actually, the two are absolutely intertwined. And often the missing bit is women in amongst all of that. Over the last year, we've been delighted to partner with Health Innovation KSS, who have been working with us to look at inequity. So inequity in terms of gender in the digital and AI workforce across the health and care landscape, predominantly the NHS. And when we looked at that data, so we did an extensive literature review of the data and interviews with amazing women across various sectors who are leading in this space. What we found is that, one, there is still a paucity of data. Two, the data that exists shows that there is still a major problem in terms of gender equity in the workforce, particularly if we look at board level, and even at board level there's masking, because when we look at digital and AI, sometimes that's masked by the nursing and other, and actually the situation is worse than expected and not shifting. And then there's also amazing practice taking place, often in pockets. The lived experience of women isn't always understood. We hear both the amazing things that they have achieved, some individuals in terms of their careers, pushing boundaries, contributing to this agenda. But we've also heard the really stark barriers that they face and the feeling of isolation, the feeling of loneliness, the feeling of not being supported in pockets. And we hear a real commitment to making a difference. And that's what we're all about. So we're really excited to partner with Health Innovation KSS to look at the future and go, what difference can we make? And it feels like actually it's begun today.
Thank you for watching this episode. We are committed to build a more equitable society and address some of the challenges that we've described and outlined in this video. So if you're interested in working with us when it comes to health equity, please do reach out and collaborate with us. See you soon.